All right, so we're gonna go ahead and begin our session here. And again, I will like to welcome Dr. Nguyen from Acuity Eye Group for being here with us today. Hi, Dr. Nguyen, how are you?
Hi, good, thank you. Hi, everyone.
So, everyone, today we're going to interview Dr. Nguyen and ask her a little bit about her job. And again, if anybody has questions, please feel free to type that in the chat box and we'll ask those questions for you, okay? So, Dr. Nguyen, can you tell us about your job and what organization you work for?
So I work for Acuity Eye Group, and it's more I guess I'm more of a medical optometrist there, where we do more diseases. We do a lot of diabetic eye exams, detecting cataract and referring them for surgery. We do fit for glasses as well. But it's mostly diseases because we see like an older population. And so I pretty much do everything, fit contact lens here and there. Not as much because we're in like a elderly population, so more diseases and everything like that. So it makes my job fun.
Oh, cool.
I still like my job.
That's awesome. How long have you been an optometrist?
16 years. 16 years. A long time.
Well, you look very young.
Thank you. Thank you. 16 years, but 1 year with Acuity.
Okay,
yes.
Awesome.
Yes. Yeah.
Did you always know that you were going to be an optometrist when you were, like, let's say in high school? What did you want to be when you were in high school?
Actually, I think I was on track to be a pharmacist when I was in high school. That's what I was thinking about. Didn't think about optometry until after I graduated college, because I tried working in a pharmacy and it didn't work out. I just didn't like it. So one of my friends' roommate was going to be an optometrist. So I'm like, oh, sounds like an interesting field. So I looked into it. Got a job at a private practice working as a technician, and I did that for a year while I applied to school, and I got in, and luckily I do love my job, so it worked out.
That is awesome. Is it is going to optometry school difficult? Was the process of applying for optometry school difficult?
Yes. Well, I mean, at the time, I guess it was like anything. I took the test, and then applied that year. They mostly based on how you did on college during college anyway. So everything was already set. I applied to 3 schools, got into 2. The other one was Chicago, which I didn't go because it's probably too cold. So I ended up going to Boston. So.
Wow.
Optometry school is definitely a lot harder than undergraduate. So definitely a lot of studying that first, few years, all studying.
Wow. May I ask, what was your undergraduate degree and then where did you go to school?
I went to UC Irvine, and I studied biological science.
Oh, okay.
Yeah.
Biological science. That's awesome.
Yeah.
And what type of GPA are we talking, or what kind of, what do you have to have in your studies in order to get into optometry school?
I think the GPA has changed in terms of like how high they're going now because it's so competitive. Back then, I think about 3.2 was good. But I think now, because it's so competitive, but then there are more schools now. I think it's up to like a 3.5 or something around there.
Okay,
yeah.
So that's good to know.
Yeah.
Was there a reason why you applied to Boston?
I think it's just the city. I was just something far away from home, and it was a hard transition to go far away from home, but it actually was good because, no distraction and everything. So all I was doing was studying. So, but I think I applied. I can't remember why I applied there, but I think it was because of the city. I actually didn't know anybody over there.
So Boston was fun. Boston sounds fun then.
It was a lot of fun.
How many years is optometry school?
4 years. So the first 3 years, the first 2 years, you're studying really hard to take the first board after the summer of your second year. The third year is also still in classroom, but you get to go to clinic. And then fourth year is all clinical rotation, where you're going to different sites and doing clinic full time. Yeah. So.
And what was your favorite thing about doing all of these clinic rotations? What made you just, how many different areas of optometry is there to learn about?
So there are actually a lot. So there's like ocular disease was one rotation, contact lens and pediatrics, and just general as well. So I did 2 at the VA and at the Veterans Hospital. So they one in Fresno and one in Portland. And so I did both of those, and you learn a lot of diseases because it's an older population. So a lot of diseases there. And then I did, my last 2 rotation was just a neighborhood health, which also like is just general. And I learned a lot, learned how to speak Spanish because I was in a neighbor. I can do an exam in Spanish, but not really that fluent. And then I did a contact lens rotation was the other one. Yeah, so it was great.
That's awesome. That's super, super awesome. Do you have a favorite rotation that stuck with you, that pushed you to go down this path to work with an older population?
Actually, when I finished, I thought I was going to do more contact lens and specialty fit because that was my last rotation. I got into the disease part, I think about 10 years ago, working with an ophthalmologist. So I didn't think I would like it that much, but actually I do. So sometimes things change, not how you imagine it would be, but it's good because it's actually more challenging. Contact lens, it can be challenging, but I think sometimes it could be repetitive and a little bit boring. But with the doing glaucoma, checking cataracts and diabetes and all that, it changes it up, so it makes the job not as boring as it could be.
What are the most common diseases that you see in your patients?
Right now, a lot of diabetics, and like I think because everyone is a diabetic nowadays for some reason, and then so I see that a lot. And then a lot of people I've seen where they didn't know they were diabetic until they came for an eye exam, because when they don't have it under control, it causes bleeding in the back of the eyes. Yeah, so and you can go blind from it. So that one, and then cataract is the other one, but cataract is not really a disease. It's sort of like getting gray hair. Everybody will get it, but it just makes your vision blurry at some point, and that's when you do surgery. But that's not as bad as the diabetic retinopathy, the bleeding in the back of the eye. So that one, with anyone with diabetes, definitely controlling the blood sugar is like a big thing, which I repeat that all day.
Okay, this is good information. For all of us people, or for everyone that is here today, like, do you have any advice for us to better care for our eyes or ourselves so we don't get to that level?
Well, for anyone who's diabetic or anything, it's just really staying healthy. Like really, I've seen diabetics who just like keep a good blood sugar control. It actually really doesn't cause a problem. It's usually the one that are poorly controlled that causes the bleeding and everything. But mostly it's just really the poor control. When it's poorly controlled and you get all these problems, you see a retina specialist. They do have some treatment, but only go so far, because once you get it, it's kind of really hard to get your eyes back to normal. So yeah. And then sunglasses is a big thing just generally for anyone, just to wear sunglasses, because that actually can cause early cataract for people who are out in the sun or work out in the sun a lot. Sunglasses for all age. This is good. Yeah.
All right, that's wonderful advice. So wear your sunglasses, control your blood sugar.
Pretty much
All
it.
right. Oh my goodness. Well, it sounds like this is a pretty rewarding job. Like, what are some of the rewards and the challenges of becoming an optometrist?
Probably the reward is like I get feedback from patient of that I can see again, or or that, you know, I detect some kind of disease. I had one where when I was working at my last job, she was like a 45-year-old patient. Actually, she was one of the employee. And then I've seen her before for like just regular eyeglasses check and everything. And then one day I was just seeing her in the hall, and then she was like, oh, why do I feel like things are like blurry on the side, and which is odd because she's young, right? So I did a visual feel on her, check her again, and then I sent her out because I suspected like she might have a pituitary tumor. So I sent her out to an ophthalmologist, and they did detect that early for her, and she got treatment for it. So yeah, so that's probably like one of my most recent one that was very rewarding. Challenges, it can get very stressful at work because I do see a lot of patients. I can probably see about 25 plus patient a day, and they all come in at once most of the time, like their schedule. But I do have good techs working them up. So, but that's probably stressful. It's just like, you know, trying to get seeing patient on time and things like that. But and then sometimes there are those cases that make you think a little bit more. So, but other than that, yeah, it's all good. Yeah.
That's all right. The great thing is that you love your job and you've been doing this for 16 years. So
Yeah.
something is sticking.
Yeah. Yeah.
I mean, I was going to ask you if there were are there good internship opportunities? You were saying that you went to Fresno and a lot of different places. So would you say that there are, if somebody was going to go into this job position?
Like for someone thinking about it, like in college and stuff like that, I think you have to go like work probably like at a private optometry place, ask to intern with them, so you learn more about the job. The one I intern is like you actually have to be in optometry school first. It's for a part of our rotation. But I would recommend that if you're interested, that you like go, you know, find a private practice or and ask. A lot of them they like to, you know, help out. And so they would like have you do an internship or even work as a tech. When you work as a tech, you kind of learn a lot as well of what the job is about. And I think that would get your foot in the door, like whether you like it or not. Because while I was doing that, I was like, okay, I do like this better than pharmacy. So so that's how it worked out. Yeah.
Wonderful advice. What type of skill traits do you think would be important for a student to become an optometrist?
I think you definitely need to have a lot of patience, and you really have to like talking to people because every day you're getting like, you know, 25 plus patient going in. They're all different personality, and you kind of have to know how to read. Like some of them like to talk and then some don't, like they chat a lot. So I think you actually have to enjoy that part, because if you're really like don't like enjoying talking to people, that this job is definitely would be hard to do that. Yeah.
Okay, so you have to have good social skills and a lot of patience to
A
become an
lot of people.
optometrist.
Yes. Yeah.
Okay. Well, so if you could turn back time right now to your teenage self, let's say you're a senior in high school, hanging out in Irvine or something, what advice or what is something that you wish you could tell yourself?
Back then, I think keep working hard, because it does end up working out. I think I was stressed back then, like figuring out what I was going to really do. So I think just keep working hard and just trying really hard. It actually did work out.
That's great. So work hard, try hard. Okay.
Try hard. Study
And
hard.
study hard. And I hope that this would be something. I was also going to ask, like, what's an advice that you can give to all of our teens or college students that are here today?
About possibly going into this field?
Mm-hmm.
Definitely I recommend, like, definitely if you're really interested, like definitely go work for like or get some kind of internship or work for an optometrist, so you kind of know that you really like it. Because I do know some colleagues who are like didn't end up not liking it during school, so like it wasn't for them. So I definitely trying it out first, to know that it is something you're going to enjoy doing, you know, every day. because like I said, I still like it. So it actually is good. So yeah,
That's
still like my job.
wonderful. That's awesome. And then what is something that, being that you're saying that you have to have a lot of patience and that you see a lot of patients,
Yes, yes.
at the end of the day, you go home, besides taking care of your kid. What is something that you do for self-care? How do you distress?
I run. That's my de-stressor. Yes. I mean, I'm trying distant run, but not yet. I'm doing a few miles after work. That's all I have time for, but that actually does help me de-stress. So yes, that helps a lot. That's my de-stressor.
I love running. This is
Yeah.
great.
Yes.
Okay. And how has this pandemic affected your job?
Well, definitely it is harder because we do have to wear a mask every day. And I actually wear a double mask, mainly because a lot of patients come in wearing the mask like half down their face. And funny, the other day, one patient asked me, "Are you wearing a double mask?" I said, "Yes, I am." He said, "Why?" I said, "For the patient who don't wear them correctly." And then so he had it on correctly, right? And then as he's talking, keeps going down, down, down. And then he's like, "Oh, I get why you say that." I'm like, yes. But it's actually, yeah, I'm learning to adjust to like the lack of oxygen when you're wearing double mask. But so far it's keeping me healthy. So it's good. It's worth it.
That's great. That's so
Yeah.
wonderful. I'm so glad you're wearing a double mask just to protect yourself.
Yes, yes.
I would like to take this time to open it up to Q&A with our audience members, because T is going to, or Dr. Nguyen is going to leave in a little bit. But I have a question here coming from Pamela. Yay, Pamela. So what are your thoughts on glasses that block out blue light?
Those are good if you're on the screen a lot. It actually does help like less stress on your eyes, especially if you're on the screen a lot. Yes.
Okay.
It does work from what I've heard. Yes.
Wonderful.
And I prescribe them mostly for kids. Like I recommend them for kids, teenage, like if you're on, nowadays they're doing a lot of distant learning. So definitely that's a good one. It helps.
That's great. Are you seeing any kid patients or young patients?
My previous job, I was seeing all kids, a lot of kids. Not currently, but I have worked with a lot of kids. Yes.
Okay.
Yeah.
What was your previous job before you worked at Acuity?
I work at a private practice, and it was in Long Beach, and so we saw a lot of kids, teenagers, younger kids, like young as 5, 6 that need glasses, and yeah, mainly because they failed the school screening. So that's how they come in to see us, and most of them do end up needing glasses. So
wow.
Yeah.
Why do you think that is? Are most kids born with vision that isn't clear, or is it because they're on the computer, or what is it, genetics?
A mix. So some are because of genetics. You're just kind of born with some certain prescription, and then nowadays a lot of screen time is actually making kids a lot more nearsighted. I mean, they overfocus up close, and then they can't see far away. So then they need glasses for that. So nowadays with a lot of screen time, that does cause that. Something to keep in mind is just to take a break, like every hour or so, look away at something far away, just to relax your focusing. And then not to have the screen so close to you. It should be arm length for everyone, their arm length. Yeah, so to not because then younger kids, like under 10 and stuff, they kind of like to pull things all the way up, and that's when they get more nearsighted and everything. So definitely keeping a good arm length distant when you're on any screen time, and then definitely an hour I would say half an hour, but I know that doesn't happen. So probably like an hour, and then just looking far away, and just to relax the accommodation. Because once it's over focusing, then you get a higher prescription there.
Wow.
Needing
So
glasses,
for
yeah.
this would be great advice for all of our teens and for college students or even your brothers, sisters, anybody that is at home on
Hmm.
Zoom calls all day long now. Take a break
Yeah.
every hour. Take a break every hour to
Yes, take a
refocus your
break,
eyes.
refocus, yeah.
Okay, yay, that's good advice. Okay, I have a question here from Jessica. Jessica asked, did
Mhm.
you have to do a lot of dissections in optometry school?
No. The first year we did human anatomy, but they did that for us. They kind of dissected for us already, but we had to learn all the areas and everything, and memorize all the, yeah. You don't have to dissect. I think that's more medical school that you actually dissect. But yeah,
Okay.
learning all the parts and everything like that, or like they already did it for us. We did look at a real human cadaver, and it did smell really bad each time we had lab. So that was like the worst. Yeah, we got through the first year of that, and we were good. Yeah.
All right, that sounds exciting. um, and then, of course, my partner Jessica here. I hope that answers your question, Jessica. And then the other Jessica asked, "What's the difference between an optometrist and ophthalmologist?"
So an optometrist, so we mostly prescribe glasses, detect diseases, and then refer them to ophthalmologists. So ophthalmologists are medical doctors. So they went through med school, and then they did a residency for ophthalmology, and they can do surgeries. So they can do surgery, injections, and all that, depending on their specialty. So, but optometrists, we don't do any surgeries. So that's the
Would
big one.
would you ever consider becoming an ophthalmologist?
No, just too much time right now. I have a young kid. Probably if I was younger, maybe. But yeah, it's just too much work for me now. But I'm happy with what I'm doing. So
Oh, that's wonderful.
yeah.
Uh, Crystal here asks, what is a typical workday for you? Do you consider this field a work-life balance friendly career?
um, yes, with my current job, yes, my hours are 8 to 5. With an hour lunch, and usually even if I finish like my patient load early, I can just leave, so I don't have to stay. Like so usually if I'm done early, finish my charting, but it's like 8 to 5. It's I don't have to think much when I'm home, so it's very good. I think that like this job, like when I was in school, I mean, definitely when you're in school, it's a lot of work. But when you actually work, it is actually not that stressful. It's actually pretty laid back most days. Yeah.
That's good. That's good. I hope that answers your question, Crystal. And then CL here asks, what about children who read physical books? For example, they read 4 hours or more a day. Holding a book at arm's length away isn't natural. What do you suggest besides taking a break every half hour?
That is also the same thing. Any kind of near work beside the screen time, reading a lot also is also a problem. I it also over focus, so definitely also taking breaks would also be good. Yeah, that one also. I know kids who love to read a lot. They are more nearsighted as well. So definitely take breaks.
All right,
Hard when you have a good book.
it's hard when you have a good book. That is very
Yeah.
true. Jessica here asked, are there good scholarships or funding resources to help someone go to optometry school?
They do offer a lot of scholarship depending on the school. Most of the school, I believe, are more private. So I went the New England College of Optometry. I went to it was more private school, so I took out mostly loans. I know Berkeley is the public school, and I think Ohio State, those public school, they would have more chances for scholarships. And then when you're into optometry school, sometimes they also have programs where they offer scholarship for certain things, like if you do excel well in lab, or do research, you also get scholarships for that as well.
Okay, that's
Mm.
wonderful, wonderful news to know.
Yeah.
And are more people coming back in for optometry visits now, or what would you say to encourage people to have their eyes checked?
Um, I'm actually pretty busy at work. So actually, people are coming in just for routine exams. I think like at our place, we disinfect and everything. So it's pretty safe, and we're making sure like people are wearing their masks. So far, knock on wood, there hasn't been, anything, major with our thing. Plus we pre-screen patient as well. So if they have a temperature, because we check their temperature at the door, so anyone with a temperature would, we would turn away. But for the most part, mostly people know when they're healthy, they come in. So and it's definitely safe to get an exam if you need to come in and get one. Yes.
Pamela asks, is VSP a good vision insurance?
It is. That's a good one. I think that's the most common one they have. So that they have good benefits with that VSP. Yes. I think the major ones are like IMED, VSP. Yeah, those are good insurances.
Mm-hmm. I think city employees, we have IMED.
Oh yeah.
Yeah, we have IMED, which is pretty common. So I hope that answers your question. And then Crystal here asked, what are some disadvantages of being an optometrist? Are there any?
What are disadvantages? I don't know if I can think of any right now, other than if you work, the only one side is like if you work in retail, like LensCraft or any of those, some private offices. The only disadvantage is the hours. Those hours are like more like 10 to 7. And I used to work those hours when I first graduated working for a private practice. So I would say that, because I like my hours now 8 to 5. So I would say, I think only if working in retail, the disadvantages, that's just the hours. But I can't really think of anything, like, because everything is pretty easy and laid back with us. Yeah.
Okay, wonderful. I wanted to ask you, I know you've held many different optometry jobs. You even had your own business at one time. So
yes.
What would you say, what led you to make all those decisions to jump from one place to another, and then from owning your own business to working for Acuity, for example?
So when I first started, I worked for Walmart. First, as a graduate, you kind of take any job at that point just to get the experience. And then I left that job to go, because it was actually kind of far. I was in Fresno. And then I went to private practice. And during that time, I think I was working that job for a couple years. And I just didn't feel like I was going to go, any higher or like move up or anything. So I decided to open my own practice. But I think that was also when we had that major crash. So that wasn't that wasn't a good idea. So but also then after that, I worked a little bit for LensCrafter, and then I got a job in ophthalmology, and that somehow just kind of clicked with me more, working in ophthalmology than in retail and private practice. So and then it kind of all led me to this job, and my ophthalmology job previously is kind of similar, doing more ocular diseases, a little bit more challenging. And so I think it keeps my job interesting every day. So something's always different. So that's how I came about here. Yeah.
That's awesome. I like that. CL here asks, an optometrist friend that she makes a greater profit by marking up prices on glasses and frames. Mm-hmm. Is that true?
That is true. They do have to mark up. Yes.
Okay, good to know. So I will say, I think I paid like $400, $500 for my glasses.
That is true. Well, then you think about, I know, only because, only a practice previously, it's to pay the rent and, the workers and all your employees and staff. So it is a markup, but I think that's how the only way they can to make it. Because exams, insurances don't pay that much, like vision insurance and things like that. So they only pay so much too. Yeah. keep a business going.
Good to know.
Yeah.
I feel like Jessica here is going to be an optometrist when she grows up. So Jessica asked, what did you mostly study in optometry school, and what was the hardest topic you had to study?
We actually study all areas in optometry school. I would say neural optometry was the hardest one. We did anatomy the first year, all the basic science like chemistry and all that. And then we study optics for optometry. And the fun one was studying about optometry and learning how to do refraction, which means checking for glasses. But the hardest one was neural optometry. That quarter was really hard. That was the hardest one.
Okay, neural optometry.
Yes.
So with the brain?
Yeah, so basically
Tell us
it's
a
just
little
sort
bit
of like
more.
so it's pretty much like neurology, neurology, except it's more focused more on the eye. So we really had to learn all the all the nerves and all that. So yeah, that was the hardest one. But we had a study group, so we got through it. We just wanted to pass.
So take advantage of all your classmates.
Yeah, all the science. Yeah, definitely make friends. Study. Definitely that helps. Study buddies help.
Okay, get yourself study buddies. Okay, they're so important. They're gonna help you get ahead. And then I have one last question here from Hardeep. Hardeep asked, do you prefer owning your own practice or working for someone else?
I prefer working for someone else because I just learned I'm not really business oriented and I like patient care more. So I would say I like that better, just seeing the patient and not have to worry the business side of it. That was hard for me because some people are more in that area and they own their practice, but for me, I like to seeing patient care and concentrating on that and not worry about the other part.
Okay. Well, Dr. Nguyen, I definitely don't want to keep you here any longer than you've already been. We're just so grateful for you to share your advice and tips and tricks and everything that it takes to become an optometrist. So I just want to thank you for giving your time. And if anybody here has questions for Dr. Nguyen, please feel free to email me and I can forward her all those questions. But for now, so thank you, Dr. Nguyen. I'm going to go ahead and turn it over to Jessica here. And Jessica is going to interview Dr. Yang, who is the clinical director of Linden Optometry Group. Okay, thank you, Dr.
Thank
Nguyen.
you, bye.
Bye, thanks. Hi, Dr. Yang, are you here?
Yeah, I'm here. Sorry, I got
great. I just want to make sure
with a patient.
Hey, awesome. Yeah. Thank you for being here and taking time out of your busy workday to talk to us.
No worries.
So you kind of came in at a good time as we were just talking about whether or not, is it better to work for other people or to own your own business? So tell us more about what you do. You're the clinical director at Linden Optometry. So it sounds like you have more of a leadership role there. So tell us about that.
Yeah, so I see patients still. So I see a lot of patients. See more complex cases. I see a lot of sometimes any problem patients come up, I will usually take a primary role on that. I also, with everything going on with COVID, there's a lot of directions in terms of like where we designate staff, how many staff can we come in, scheduling wise, doctor schedules, patient schedules, everything like that. So it's a lot of coordinating through that.
How much of your day do you say you spend seeing patients?
Majority of the time. So right now I work 5 days. I'm technically on the patient schedule for 5 days, and then I'll go in on an extra 6th day, and I'll usually use that day as an administrative day.
Oh, wow. So you work extra.
Yeah, I work extra.
You work a lot. Yeah. And how long have you been at Linden and as working as an optometrist?
So I graduated school in 2016. I started working part-time at Linden Optometry. I didn't become the clinical director until last year. So I've held my position for about a year now.
Congratulations.
Yeah. After school, pretty much bounced around different types of offices. Got to work in private practice. We're a pretty big office. We are considered private practice, but we have pre-COVID, we had 10 to 12 doctors working each day. Right now we have 6 to 7. Yeah.
Okay. And what was your path like to deciding to go to optometry school? Was that something you'd always planned on? What did you study in college?
So I went to UC San Diego for undergrad. At the time I was just pre-med, thinking medical school or dental school, pharmacy school. For me, it was a sort of like a process of elimination type of thing. So I thought about medicine. My parents had me later on in life. And so I was hoping to get out of school and then start a family at an earlier age. As opposed to going to medicine, you have 4 years of undergrad, then 4 years of medical school, then you got another like 4 to 8 years of residency training. So that's a lot more schooling. Dental school, I didn't want to look at teeth every day. So
That's
thank
important
God.
to know.
Yeah. Thank God for dentists. They're looking at teeth all day, but that's not me. Pharmacy, I thought about being pharmacist, but I couldn't push pills all day. I couldn't count pills, and I still wanted the patient interaction. So optometry worked out for me just because I remember the first time I got glasses, it was a pretty life-changing experience. Being able to put on a pair of glasses and then see that trees actually have leaves, people actually have faces. Like, you should actually be able to recognize these things. It's a pretty big deal. So I remember my experience with the optometrist. I still get the patient aspect, so I still get to communicate with patients, have practice bedside manner, try to help them out, and hopefully in better times you get to spend a little bit more time with patients. It's just nowadays got to be a little bit more efficient.
Mm-hmm.
But yeah.
And which school? So did you go straight to optometry school after undergrad? And what school did you end up choosing?
I did UC San Diego, and then I took 2 years off and worked as a lab tech down in San Diego. Found out that wasn't the career I wanted to go down. Just sitting behind a desk all day. So after that, I applied for optometry school, got into the Southern California College of Optometry. Right now they're called Ketchum University because they just branched out. They're located in Fullerton. So, and I graduated 16.
Yay.
Yeah.
I asked this to our last guest, but were there any scholarships you found, or was there financial assistance for optometry school?
There's a lot of scholarships. There's some based on just like the society, like the location you're in, based on academics, based on ethnicity. There's different types of scholarships available. A large part of grad schools nowadays are federal loans, which means once you start taking out the money, the interest starts to accrue automatically, which sort of sucks. But at the same time, I see it as an investment in yourself. So I would say anybody that's going to go into any kind of grad school profession, whether it's law school, dental school, nursing school, GMAT, whatever it is, make sure you know what you're getting yourself into. Meaning go shadow, go pick the brains of people that you want to become. Just spend time making sure that before you spend the money and the time, that it's definitely something that you want to get yourself into.
Thanks for that. And also, now that you're about 4 years out of school, do you feel that if you do have any student loans, has it been manageable given the jobs that you've been able to get to, have a good balance in your life and be able to continue paying off those loans? Or for someone on average, would you say it's possible?
Yeah, I would say it is. It's probably a little bit tougher to do in Southern California, just because given our cost of living, given how much rent and everything is here. I am very fortunate enough I still have student loans, but I am very fortunate enough to love what I do. So I've been there's times where I've worked 6 days a week, I've worked 7 days a week, I've worked months straight. But part of the reason why I could do that is because I actually really enjoy what I do.
Mm-hmm.
I also have my wife differs, but I have the personality where I could go to work and then go out, hang out with friends, and then next day go back to work and still be able to do it for a little bit. But she's more introverted than I am,
Mhm.
so she'll actually say, no, we can't do this, but I'll still
Right.
try. Yeah.
Um, I do want to ask, for our young people listening in today, um, knowing everything that you do about working in the field, if someone is considering maybe a career in optometry, do you have any recommendations for, could they go in and try to get some kind of experience while they're still in high school?
Oh yeah, definitely. So recently I had my wife's younger cousin come shadow us. They can just reach out to me, just shoot me an email, let me know who you are, and then I'll try to set something up. It's as long as it's probably for a couple hours a day. Because yeah, it'd be okay. Just let me know.
Great. Yeah, and just in general, I think people are looking for advice and tips on how to get into certain career fields. So that's a really great tip you have. So just even talking to to anybody out there, if you go have an eye exam, you can ask your eye
Mhm.
doctor about something similar. And then for you, what you said, you love your job. So what do you love the most about it? What gets you the most excited about going to work every day?
Um, I think a large part of it is just remembering my personal experience of being able to see. I I specialize in what's called keratoconus. Keratoconus is a condition in which just regular glasses or regular contact lenses isn't going to be able to help them see as everybody else sees. So I specialize in these specialty contact lenses that basically they take them from not being able to see past their hand all the way now they can see for far away. And so that's a game changer. So yeah, I do a lot of that. I think it's the people that you work with too. I really enjoy the people that I work with. I enjoy patients most of the time, just depending on their different personalities. But I think each patient brings in a little bit different person, a different thing every time.
Right. Dr. Nguyen talked to us about that, about how being a people person is a really a necessary skill in your
Mm-hmm.
profession.
Yeah.
Yeah. And we also talked with her about COVID precautions. And
Mm-hmm.
obviously, any patients who come in must wear a mask. Now, she talked about a lot of patients not wearing their masks properly. So she
Mm-hmm.
would wear double mask. And I wonder for you, is it the same? And if you see, even during a visit or an exam, a patient's mask is falling below their nose, because that often happens, do you feel comfortable telling them? Do you feel it's your job to just kind of remind them gently? And how do you do that? How do you approach that? Because I feel like that's actually maybe wasn't part of what you thought your job would be when you went to
Mm-hmm.
optometry school, but
Yeah.
navigating those nuances with people can be challenging. So how do you deal with that?
So luckily for me, because I am the clinical director, I basically every time I'm running around the office all the time. Anytime I see somebody's mask slip beneath their nose, I have to remind them you got to pull it up above your nose. If their patients don't want to wear a mask, then I have the right to kick them out of the building. What else? I
Have you
think
had to do that? I hope not.
not yet. There's
Good.
been patients that we haven't let in because they won't want to wear a mask. Um but it's on them, unfortunately. Um a lot of it is there's a trick to wearing glasses and masks together.
Tell us.
Yeah, let me actually grab a mask and let me actually get the glasses too.
Thank
So
you.
yeah.
Yes.
So let me go do that.
While we're
Oh,
waiting, if anyone has any questions that they have in mind that weren't answered already, feel free to type those in. Oh, that's a good question. Is it important to follow every policy and rule given? It sounds like with this particular rule, it's very important given how highly transmissible COVID-19 is.
I
So
agree.
for anybody that's out there that wears glasses, this is pretty helpful. If you have just a regular mask or a surgical mask or any kind of mask, the trick is put the mask on first. And then people always think that in order to prevent the fogging, you actually have to lower the mask over your nose, which is definitely not the case. The trick is actually to pull it up higher above your nose. If you have a wire, the best is use the wire to tighten up the nose part. And then after that, then you set the glasses on over the mask. So I don't have my clear glasses. My clear glasses are at the office, but yeah.
And it doubles as a great disguise if you feel like going incognito anyway.
Mm-hmm.
So thank you
Yes.
for that demonstration.
Mm-hmm.
Yeah. And always wear your sunglasses when you're outside, okay, guys?
Oh, and the sunglasses. Yes, another important reminder from the optometrist.
Yeah.
What are sunglasses are really important, and they're taking a back seat now due to COVID. But I know, how do we make sure that when we're trying to shop for sunglasses, that they actually they do block UVA and UVB rays?
Mm-hmm. I would say majority of lenses nowadays, as long as it's plastic, as long as it's polycarbonate, then the lenses in there should block the UVA and UVB. If it's automatically polarized, I would consider it automatically blocking UVA and UVB. So I wouldn't worry about that part. Anytime you get sunglasses, I recommend getting the polarized just because it cuts down half the amount of glare coming off screens and off the like when you're driving, it cuts the reflections off the lights. But other than that, yeah, I would wear sunglasses.
Okay.
Yeah.
So yeah, I guess along those lines, and we asked this question of our last guest,
Mm-hmm.
what are the top, including the sunglasses, it can include the sunglasses, what would be your top 3 recommendations, especially to young people who have their eyeballs are young and they have time to protect their eye health? What are the top 3 recommendations you would give?
One, go get an eye exam. That's probably go get your eyes checked. That's probably pretty important. There's a lot of different studies right now with what's called myopia control. So that's for people that are nearsighted. I would say right now because it's a younger audience, right? People in high school.
Yeah.
With everything moving more towards virtual screens, I would say there's a study right now that says if you're looking at anything up close, whether it's your phone, laptop, computer, even reading books nowadays, the studies say that try not to go longer than 45 minutes at a time. So try to space it out. Generally, I would say usually the optometrists in the past have always recommended what's called the 20-20-20 rule, which is every 20 minutes, look at something 20 feet away for about 20 seconds. To be honest with you, if you truly practice that, I would think you would be the most inefficient person possible, just because you can't really get anything done. So what I recommend is just every 45 minutes, try to look at something far away and try to like relax your eyes and then come back to it for another 45 minutes. The other study that I bring up to patients a lot is, as dumb as it sounds, a lot of they've done studies measuring people's blink rates in front of a computer, and they found out adults in front of a computer blink less than a third of the time compared to normal. So what that's going to do is that's going to cause your eyes to dry out, and it's going to cause your eyes to fatigue out. So we're already in a dry environment because, one, we live in Southern California where it's a relatively dry environment. 2, if you're in a car or building with the AC, fan, heater, any kind of circulated air, that's going to dry you out. 3, as dumb as it sounds, when you look at your computer, you're just forgetting to blink just because you're so focused on what you're looking at. And that could be your computer, phone, laptop, tablet, paperwork, documents, homework, whatever it is. That's going to cause your vision to go in and out of focus. So that's probably my top 3. Just make sure you go get your eyes checked. Try to take breaks, try every 45 minutes or so, and then just remind yourself to blink. And then if needed, then use some lubrication drops.
Thank you for those very important tips. I'd like to ask, what are maybe some of the biggest challenges you face in your work?
Nowadays, trying to get people to wear a mask.
Right.
Yeah.
Yes, that I could see that. And then outside of that, what have been?
Just sometimes, so we're, even as optometrists, we do a lot of customer service. So just making sure that patients are happy with their glasses. They ask us why the glasses are taking so long. It's because all the labs are backed up. Trying to listen to patients complain about their different problems. That happens quite a bit. What else? It's a lot of different complications with patients. Usually it's customer service related, I would say.
Mm-hmm. But you got to your position probably because you're also good at handling different scenarios. So
I would think
you're
so.
good
I would
at
hope so.
it.
Yeah, I would definitely hope so.
Yeah.
Yeah.
Okay, so I have two more questions. One is, what do you do? You work hard. You work, sounds like 6 days a week, maybe more. What do
Hmm.
you do to take care of yourself? What do you do to relax?
I play a lot of golf. So I used to play a lot more basketball, but because of I don't want to get injured. I used to have sprained ankles, so I can't walk around the clinic with a sprained ankle or a torn ACL or bad back. I at this point, basketball to me is more cardiovascular. It's just get up and down the court, try to stay healthy. So for me now, I play a lot of golf. For even as much of a people person as I am, as much as I like talking to people, I still need to get out to a course. I don't have to talk to anybody. I just chase my own ball for 4 hours. So I
And
do.
that's important. You have to
Yeah.
recharge, so good to know.
Hmm.
And lastly, if you could turn back time or give advice to your teenage self, could be with regards to career in school, what would you say?
Um, Save money, invest my money. Yeah, whatever money I have back then, put it in the stock market, put it somewhere safe, put it in a retirement fund. That money grows pretty quickly especially if you set it aside. Um, I would say, yeah, besides financial advice, I don't know. I have a pretty good life. I can't get it wrong. Yeah, I do work hard. I like to play hard, but um, find people that you love to be around with. Find a job that you love doing. Um, yeah.
Thank you. And
Hmm.
your financial advice leads in beautifully to our next Career Day topic, which will be in 2 weeks. And that will be our financial career day. So for those of you who want to get more information about that, join us. And Lynn has another series that she'll talk about in a minute. But again, thank you so much for sharing everything today. If you guys have any questions, now's the time. You can raise your hand. We can put your mic on, or you can just pop it in the chat. And in the meantime, Lynn, if you want to, do you want to talk about what's coming up?
Yeah, I'd be happy to. So starting next week, we have our Med Talks program series that we're kicking off to highlight not health topics, but the one for next week is going to be about mental health. So we will be meeting with a licensed clinical social worker and a mental health clinical supervisor that works for the Department of Mental Health. And she will be doing a presentation on the stigmas of mental health and signs to look for, and also about diseases and prevention. So if you guys want to kind of learn more about the job or just understand more about what mental health is, we're going to be hosting that program, and it's part of a it's a 5-part program series that will also cover diet and nutrition, female health, and there's also diseases, cancers, and end-of-life care, as well as skincare. We have a aesthetic dermatologist, a physician assistant that's going to be doing a presentation. So I will link that into the chat box so you guys can sign up for the program or submit your questions. And yeah, that's pretty much it. So we're just really excited to host that series, and it's going to be with a mental health. It's going to be with a medical student graduate that will be helping us host the program. So really excited. Mm-hmm. I'll go ahead and link that in the chat box right now for the sign-up sheet, since it's more of a presentation. So yeah, please do take the time to fill out our 2 surveys that we linked up at the top. And then Dr. Yang, thank you so much. If anybody has any more questions, please do ask those questions. And if not, we'll let you go.
Also, if anybody wants to reach out to me, just have them shoot me an email, and then
Thank you,
Yeah,
Dr.
my email.
Yang. You're so great. You're
Yeah.
so great. And thank you for being so helpful, because I can tell we do have a lot of students here. I want to point out Jessica, who has just been so, she's been really, really enthusiastic about asking all these questions. And I think it's good to know that there is help and there's guidance available for someone that is young and interested in going into this career field, because I can definitely speak for myself since I'm like an old person, but if it wasn't for my mentors or for people that just said, hey, come check out this job, I probably wouldn't be here today doing this awesome job that I love so much. So yeah, go ahead and I think we're good then. I don't see any more questions here in the chat box, but I think everything that you presented today, Dr. Yang, was just an overwhelming amount, and just so much great information for everyone to take on. And definitely wear your sunglasses and take a break every 45 minutes. I know Dr. Nguyen mentioned an hour every hour, but I think 45 minutes is good too. And then yeah, wear your sunglasses.
Don't forget to blink.
Don't forget to blink.
Yeah, don't forget to blink. That's a pretty big one right now, because I have a lot of patients, especially because it's so dry outside. I have a lot of patients coming in like complaining that their vision goes in and out of focus. And like the best way I could explain that is the very front surface of your eye is supposed to be a nice, smooth, watery tear film. If anybody's ever seen oil mixed with water, they don't mix. So what ends up happening is, instead of you looking through a nice, clear, watery surface, now there's pockets of dry spots on your eyes. And then so that causes your vision to go in and out of focus all the time. So just remember to blink.
You guys heard it from Dr. Yang. Remember to blink.
Yeah.
All right. Anything else, Jessica? I think this has just been such a great panel.
That's it. Actually, unrelated to today, tomorrow for teens, if you're still in high school and want to attend, we're having Teen Line, the crisis hotline for teens, talk to a group of us about healthy relationships. So if you don't already have my email, I'll pop it in the chat box. You can send me an email if you are interested. But yeah, otherwise that's it. And we look forward to seeing you guys at Med Talks next week.
Yeah, thank you so much for being here with us today, Dr. Yang. And
Thank you.
We hope everybody that walks into your office wears a mask.
Oh, yeah. Thanks.
Yeah.
Thank you. Bye.
We'll definitely reach out to you. Okay. Have an amazing day and rest of your week. And Jessica and I will hang out here if anybody has questions for us in the next 5 minutes. Otherwise, we'll let everybody go. Thank you. Everybody who's filling out our surveys. Thank you, Dr. Yang. Have a good one. All right. Hope you guys enjoyed that.
Jessica.
I'm going to go ahead and stop